So I started my journey. I started trying to attempt to take hormones. And at the time, I exhausted every single youth organization that dealt with distributing hormones to trans women. Like I remember I went to one program and I did 14 weeks, and the lady said, "Oh my God, you're smiling, Chanel. Oh my God, I'm so happy for you. Why are you smiling?" And I said, "Girl, it's been 14 weeks, girl. I'm about to get my hormones." And she said, "No, you had one session. And then you start talking to your family. I feel that you need to work on your family situation first before we decide to do hormones." The counseling I did with you for 13 weeks, that was family counseling.
Once I hit my early 20s, I started to have a lot of reproductive issues, PCOS, so polycystic ovarian syndrome. Band-Aid option was to put me on birth control, which at the time was okay because I was still identifying as female. When I started to transition, birth control was no longer going to be an option, so we switched to testosterone. Ended up last year having uterine cancer. It was stage 1, fortunately, when we caught it. Half of it might be genetic, half of it might be the testosterone. A little portion of that might be because I was on birth control for so long. And I didn't want people to think that I was weak or that I had somehow done this to myself, because a lot of people were really quick to blame the testosterone.
So I steeled myself against nursing school before I even walked in the door. I had every reason to believe that I was walking into enemy territory, where I would be gender policed like crazy and nobody would care about me if I didn't have childbearing plans for the next 10 years. It was hard to be genderqueer and queer sexual in that space, but I had a lot of support from my fellow students and the people in my cohort.
Since I see so many doctors, specialists in addition to my primary care, I've had to reteach kind of everybody. So I have to go in and with my miniature 2-minute Trans 101 lecture, they don't know how testosterone works in a female body to the extent that what we're doing.
Because the provider I was working with took it upon herself to get incredibly educated about side effects of hormone management and how to do it safely and how to, what the cutting edge thing is, and let's switch you from injections to oral meds. It's, they were in really competent hands, and that is incredibly rare.
I had one healthcare provider who didn't know anything about queer people, and once the stirrups were involved and there was a speculum, he did not listen to me when I said, "Please stop because this hurts." At that time, I felt completely helpless. I didn't know what to do. I was still in the early stages of transitioning. Knowing what I know now, I'm a little bit more vocal. I will ask to talk to. There's always like an office supervisor. I'm a little bit more insistent about talking to either the nurses or the doctor. Whoever I'm having a problem with, I'll just talk to the opposite person.
They only give you hormones if you were on hormones outside. So nobody starts hormone therapy inside.
They were all like 17, 18, and one of the young ladies, one of the trans girls that was locked up with, her sister was actually a nurse for a doctor's office, a private doctor's office. And she told her sister accepted her transition. She told her sister, "Listen, I'm about to go to jail, girl, and I need hormones, and I need to hook up my girlfriends." And her sister, pretended to be a doctor. And she gave all these crazy different prescriptions out, "Oh, well, yes, I'm the doctor of such and such, and yes, she has been taking hormones for such and such time, and I would like to give her 4 cc's of Delestin."
Having competent trans care for the first time in their lives from a medical professional while incarcerated, and having that care be contingent on their incarceration, How fucked up is that, you know? Finally, they have something that they deserve, that keeps them healthy, that keeps them happy. They have somebody listening to their concerns about their body and validating those and helping them overcome problems that they've had since they were born, you know? What a wonderful thing. And you can't be free, and you're constantly under threat of violence, or you have to be completely isolated in order to have that access.
I was supposed to get hormones too, but the thing about it didn't work for me because I was 15. I needed parents' consent, no matter if the doctor said or what. I need to ask my mom. So I had to start buying the hormones illegally from the other girls, because as you said, that's a lot of hormones. So the girls started feeling different, as well as
yeah, I mean, like, if you take too much estrogen, doesn't it metabolize as testosterone?
Mm-hmm. So I decided just to cut hormones cold turkey, and I swear I could just feel the difference. Like, I became so depressed. When I look back at my transition, I think of all the key points or bullet points of people basically stating the rules and law of transitioning. That I just was like, you know, fuck that, I'm gonna do this. No, you gotta follow the rules.
You know, there are places like in Chicago that have informed consent, where you just have to prove, you can go to counseling, but you don't have to. You just have to prove that you understand what the risks are of taking hormones, and then they let you take hormones. Like, what do you think of that?
I don't know how I feel about that. I mean, for certain girls, I guess it would be nice, but I kind of like the way they have it in New York, where that's, if you say that you understand, they still make you go to at least one.
Yeah.
At least one, just to get a real understanding, which is what I had to do. At the age of 21, I went and I did my one session, and I got my hormones.
That's after 10 years of wanting it.
Yeah. You need family, like, whether it's your biological family, your made-up family, but you need a support system. When you are transitioning, you need a support system, because you're going to have up and down days, and you're going to need somebody. You're going to need somebody there to let you know how special you are and how beautiful you are in and out, and that no matter what happens in this tender stage of your transition, you are who you are, and you deserve to be happy. And I didn't have that.
What bothered me at my hospital stay was being in, they put me in my own room. I was really isolated. The nurses were the last people to see me if I was clicking the call button. So what a doctor can do is just to make sure that their staff is being receptive, and that this is the person you're seeing, this is my patient. So just being another advocate for me would have been great, because if they don't do that, then I have to, and I'm still a patient, recovering from surgery. I had a bunch of nurses ask me if I was there for a sex change, which is totally inappropriate, and I did not appreciate being asked that. So it would have been great if a doctor had stepped in and said, this is my patient. These are okay questions, and these are not okay questions.